Locoid cream is used to treat a variety of skin conditions such as eczema, dermatitis, allergies, and rash. It helps reduce swelling, itching, and redness that can occur in these types of conditions. It can also be used to treat severe dandruff, seborrheic dermatitis. Locoid cream is considered a medium-strength corticosteroid. Now, let's talk about how to use Locoid cream. First, remember to only apply this medication on the skin, and never on the face, groin, or underarms unless your doctor tells you to. Before using the cream, make sure to wash and dry your hands. Then, clean and dry the affected area before applying a thin film of the medication and gently rubbing it in. The frequency of application depends on the form of the medication. If it's ointment, cream, or solution, you'll usually apply it 2 to 3 times daily, as directed by your doctor. If it's lotion, you'll usually apply it 2 times daily. Remember not to bandage, cover, or wrap the area unless your doctor tells you to. After applying the medication, remember to wash your hands, unless you're using the medication to treat your hands. If you're applying the cream near your eyes, be careful not to get it in your eyes, as it may worsen or cause glaucoma. Also, avoid getting the medication in your nose or mouth. If you do, rinse with plenty of water. It's important to use this medication only for the condition for which it was prescribed, and not for longer than prescribed. If your condition lasts or gets worse after 2 weeks, inform your doctor. When you first apply Locoid cream, you may experience stinging, burning, itching, irritation, dryness, or redness at the application site. These effects should go away after a few days as your body gets used to the medication. If they persist or worsen, notify your doctor or pharmacist immediately. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's essential to tell your doctor right away if you notice any serious side effects, such as stretch marks, skin thinning/discoloration, acne, unwanted hair growth, or small red bumps on the skin, folliculitis. Using this medication can worsen skin infections. If you notice that redness, swelling, or irritation does not improve, notify your doctor promptly. In rare cases, this medication may be absorbed into the bloodstream through the skin, leading to side effects of too much corticosteroid. This is more likely in children and in people who use the medication for a long time or over large areas of the skin. Contact your doctor immediately if you experience unusual tiredness, weight loss, headache, swelling ankles/feet, increased thirst/urination, or vision problems. While very rare, a serious allergic reaction to this drug could occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Before using Locoid cream, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to disclose your medical history, especially if you have poor blood circulation, diabetes, or immune system problems. Do not use Locoid cream if there is an infection or sore in the area to be treated. Using corticosteroid medications for a long time or over large areas of skin can make it more difficult for your body to respond to physical stress. Before having surgery or emergency treatment, or if you get a serious illness or injury, inform your doctor that you are using this medication. If used for a long time, this medication may temporarily slow down a child's growth. It's important to regularly see the doctor so your child's height can be checked. During pregnancy, Locoid cream should only be used when clearly needed. It is unknown if this drug passes into breast milk when applied to the skin, so consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that may occur when using Locoid cream. Some medications may affect how Locoid cream works or increase the risk of experiencing serious side effects. To ensure your safety, it's crucial to keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this list with your doctor and pharmacist. Never make any changes to your medication dosage without first consulting your doctor. Always follow their advice to avoid any potential risks or complications. If someone accidentally swallows Locoid Cream, it can be harmful. If the person has serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is essential to keep Locoid Cream out of reach of children to prevent accidental ingestion. Always follow the advice of a healthcare professional when using this medication. Do not share this medication with others. This medication has been prescribed for your current condition only. Do not use it later for other skin problems unless told to do so by your doctor. A different medication may be necessary in those cases. Lab and/or medical tests, such as adrenal gland function, may be done while you are using this medication, especially if you use this drug for an extended period of time or apply it over large areas of the body. Keep all medical and lab appointments. Consult your doctor for more details. If you forget to apply a dose of Locoid Cream, apply it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and continue with your regular schedule. Do not use double the amount to make up for the missed dose. It's important to store Locoid Cream at room temperature and keep it out of reach of children and pets. Make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. When the cream is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.